Hello and welcome to my YouTube channel Lectures Update. I hope you all audience, you all viewers, you all people will be fine and good well and more enough than I can expect. Dear friends, dear viewers, in the in this YouTube channel Lectures Update, I had started the physiology lectures in which I had discussed different topics of physiology like definition of physiology, different systems of the body plus circulatory system. I had started circulatory system with details, plus after the circulatory system I had also discussed the different different things like I had discussed the different vessels of the body, heart, muscles of the body, plus I had discussed the further systemic circulation, pulmonary circulation and many more topics. But now in this video here I am going to discuss you a very good and amazing topic which is called pulse. So pulse is in medical the number of times the heart beats within a certain time period, usually a minute. The pulse can be felt at the wrist, side of the neck, back of the knees, top of the foot, groin and other places in the body where an artery is close to the skin. So from these area we can just simply we can detect the pulse, we can feel the pulse. So types of pulse rate: peripheral pulses that can be felt in the periphery of the body by palpating an artery over a bony prominence. Examples are carotid, radial and popliteal pulses. Apical pulses, which is central pulses located on the apex of the heart, that is usually monitored using a stethoscope. A normal resting heart rate should be about between 60 to 100 beats per minute, but it can vary from minute to minute. So this was about the pulse. Before starting the next topic, I kindly request you to please subscribe to my YouTube channel Lectures Update and press the bell icon to receive the upcoming notification of my upcoming videos. Now I will discuss the types of pulse rate. After types of pulse rate, I will discuss the blood pressure. So basically the blood pressure is the force exerted by the blood on the walls of the blood vessels. The blood pressure is measured by an instrument called blood pressure apparatus, sphygmomanometer or BP set. There are different types of blood pressure apparatus, but the one commonly used is by a column of mercury, which the pressure supports. The height of the mercury column is measured in millimeter. The normal systolic blood pressure varies according to the age of a person, but it is usually exobese 120 millimeter and systolic blood pressure, while the diastolic blood pressure is around about 80 millimeter. The blood pressure is affected by the amount of fluid in blood vessels. If there is a lack of fluid, either from the loss of blood through hemorrhage or diarrhea or from continuous vomiting, the pressure falls. If there is an excess of fluid in the blood vessels, the pressure rises. This occurs in case of kidney disease when the excretion of the fluid fluids via the kidneys fails, or if there is disease in the heart or circulatory system. A young individual blood pressure is around about 120 by 80. So 120 means the systolic blood pressure. When the heart contracts, this is the systolic blood pressure, and 80 is the diastolic pressure in which the heart relaxes. So a high blood pressure is a pressure when diastolic pressure rises above 95 millimeter. The normal diastolic pressure varies from 80 to 95 millimeter of Hg. Hg mean mercury, because we can determine this blood pressure in the mercury compared with the mercury. So At low blood pressure is a pressure. A low blood pressure is a pressure of 100 millimeter or less systolic, and the reading of the diastolic blood pressure is for below 80. Low blood pressure occurs in case of hemorrhage, heart failure, shock of collapse, sweating, more, and some diseases. In some diseases like heart failure, heart hemorrhage, in these cases the blood pressure becomes low. This is called low blood pressure. Also medical term is used for low blood pressure, which is called hypotension, and also a medical term is used for the high blood pressure, which is called hypertension. So these are also related to increasing and decreasing of blood pressure. Another system here we will discuss will be a lymphatic system. So basically, a lymphatic system, the tissues and organs that produce, store, and carry white blood cells that fight infections and other diseases. This system includes the bone marrow, spleen, thymus, lymph nodes, and lymphatic vessels, like the networks of thin tubes that can carry a lymph and white blood cell. This system is composed of lymph vessels and glands. If we talk about the structure, a small bean-shaped structure that is part of the body immune system. Lymph nodes filter substances that travel through the lymphatic fluid, and they contain lymphocyte white blood cells that help the body fight infection and disease. There are hundreds of lymph nodes found throughout the body. If we talk about the lymph, so basically lymph, it is similar to plasma but contains less protein. Lymphatic vessels begin either as minute flexes of small capillaries or lymphatic spaces in the substances of tissue. Lymph glands are small oval bodies placed in the curves of lymphatic vessels and joined together by this. The main group lie on the neck, axilla, thorax, abdomen, and groin area. The function of the lymphatic system is to return fluid and protein from tissue to circulation, to transport lymphocytes from lymphatic glands to circulation, to carry emulsified fats from intestine to circulation, to filter out and destroy microorganisms and prevent the infection. The lymphatic ducts are the terminal lymph channels that empty into the subclavian vein to return the lymph to the venous circulation. In human, there are two lymphatic ducts, the right lymphatic duct and the thoracic duct. Spleen. The spleen is the largest lymphatic organ in the body, surrounded by a connective tissue capsule which extends inwards to divide the organ into lobules. The spleen consists of two types of tissue called white pulp and red pulp. The white pulp is lymphatic tissue consisting mainly of lymphocytes around arteries. Lymphatic drainage, the flow of lymph from an area of tissue into a particular lymph node. The lymphatic system can be thought of as a drainage system needed because as body circulates through the body, blood plasma leaks into tissue through the thin wall of the capillaries. The lymphatic fluid flow from the lower extremities, the liver and intestine, to the thoracic duct, which is the main channel for the lymphatic drainage. So dear viewers, dear friends, dear audience, was our today videos. I hope you will like my video, I hope you will understand my video, and my video will be helpful for you in your next exam session. So keep watching my videos, keep remember me in your prayers, and also please subscribe to my YouTube channel, lectures update. Thank you so much and goodbye. Take care of yourself.